All set.
Okay. So I want to welcome everyone tonight. This is another episode of our ASES research webinar series. We've been now working through three webinars a year for now the past 2.5 years, and now we're moving on to our third year. So I'm happy to be here hosting this with my co-host, Peter Simon, who's the co-chair of the ASES Research Committee. And we're really lucky tonight to have three well-known surgeons within our society that have a lot of experience. And tonight's topic is going to be a little bit different. And I was mentioning to Bill here, Levine, how this came about. And one of the questions that I'll get asked is, you are where you are in the world of shoulder and elbow surgery. How did you get there, and kind of what is the pathway that you took, and potentially how does research how has that been involved in that pathway? And because of that, I asked and reached out to three people who have a kind of wealth of knowledge in that area, as well as are great people to talk to about these types of things. So the topic tonight's going to be how to become an expert in shoulder and elbow surgery, and we'll hear from three surgeons. First, we'll hear from Bill Levine. So Bill is the chairman at Columbia, the orthopedic department, and also past president of the ASES. Jerry Williams, who is at the Rothman Institute, also past president of the ASES as well as AAOS. And Jim Kelly, who is currently the director of the San Francisco Shoulder and Elbow Fellowship, as well as chair of CPMC orthopedic department out in California in San Francisco. So we're going to have each of them kind of discuss their experiences, and then we'll talk a little bit about it. But before going into that, I want to thank Smith and Nephew, who has been actually a strong sponsor of this series that we've run in the past, as well as this series tonight. And we're going to have a short clip from them right now.
At Smith & Nephew, we strive to put solutions in your hands that can allow your patients to live a life unlimited, and the shoulder space is no different. Here at Smith & Nephew, our focus is on providing you options throughout your patient's continuum of care with cutting-edge products like Regeneten, a bioinductive implant that redefines biologic healing for rotator cuff tendon growth, and the new ATOS shoulder system starring the ATOS Metastem that allows for maximized stability and an elevated surgical experience with an efficient system to help simplify shoulder surgery. We are honored to support the ASES Foundation, and it is our mission to continue to provide you with the most innovative solutions in the shoulder to help restore the patient's ability to live their life unlimited.
Great, that's perfect. And again, we want to thank them for sponsoring this series and helping out the work that we're trying to do from the research front, from the research committee. So with that, we'll go over to Bill and he'll talk about his experience of becoming an expert. So Bill, thanks for being here.
Hey, thanks, Bob. Can you see my slides?
I can. They look
awesome.
Great.
Peter and Bob and ASES, and of course to Jim and Jerry, thanks for putting this together. It's fun to see some former fellows and some of our medical students on the guest list here tonight. So these are my disclosures, and as I was just saying with the guys, I never had a disclosure with the company until last year. So that's one thing we can talk about in the discussion, but those are my disclosures that are very important for this. So if I think about this, and you guys ask this question, like, why should you do research? What's the reason? And I think it helps yourself as an individual to become an expert. It helps your patients because you can actually start to learn about what works and what doesn't work. It certainly can help your career trajectory, and then it can help establish your reputation, which I think is important as you think about this topic. So if you think about that from helping yourself perspective, you're in college, you want to get into medical school, well, you might do some research. You're in medical school, you want to go into orthopedics, you need to do research. Residency to the top fellowship, you're going to have to do some research. And even fellowship to jobs, especially, of course, if you're going into academics. And so I think about this going back to 1982 and my first opportunity at Stanford. It was actually in the Department of Urology. I was doing some rabbit research with these really cute little white bunnies, which was very sad, but it got me at least exposed to what research was all about. And I go to Case Western, and I knew I wanted to do ortho, and I knew it was super competitive, and I knew I had to do research. And I met this guy, Peter Scholes, and he said, "Hey, I've got the perfect project." And we had the Hammond Todd collection, which had 2,974 skeletons housed in these little drawers. And so I wanted to look at tarsal coalitions because it was something easy to do. And I thought, wow, this is awesome. I got to spend hours and hours and hours going through this. And this was my first experience with research disappointment. This never got published, Bob. Like so much work, and it never got published. But I got to present it at a national meeting, and it was my first kind of experience with that. I go to residency in 1990. We were working really hard, and I did zero research as an intern because we didn't do 6 months of orthopedics back then. And then I get to Tufts, where I was interested in research, but there was zero infrastructure, and Tufts wasn't really known for doing research. So I just kind of got interested, and I asked some questions, and this was my first publication. And I look at this, it's like 30 years ago, just 2 case reports. But what that did is it established myself as somebody that the faculty could say, "Hey, are you interested in doing this project?" And so then I got these mentors, John Richmond and Tom Thornhill, and I started to get a reputation for being a closer because I would actually finish the project that I said I was going to do. That was a bad mistake, because then that gets you lots more projects, sometimes good, sometimes bad. I go to my fellowship at Columbia, and lots of research. And now we're starting to really start to dive into all of the world of shoulder and elbow. And this is where I say, help your patients, guys, because I started to ask questions that were impacting patient care. Like, what was this thing about thermal capsulorrhaphy? And Ken and I saw these patients that were being harmed by it. So we went to JBJS and got this published really quickly. Or what about painful hemiarthroplasties? They didn't do so well when we converted them. So the notion that there was something being done clinically and we might be able to influence it. And then, of course, doing better studies and randomized control studies later in my career were really important and impactful. And if you look at the career trajectory, yeah, it starts out because you're going to be doing work and you're going to go from assistant to associate to professor, if that's what you want to do. And there's lots of things that happen all because of research that allowed that to happen. And this is where I say it helps to establish your reputation, because I wasn't trying to get involved with industry 2 years into practice or 3 years into practice. I was trying to become an expert in figuring out what the hell to do as a shoulder surgeon. And if I was going to be up at the podium, I needed to talk about my own patients, not Dr. Biliani's and not Dr. Flato's and not my mentors, but really talk about my own. So it took a long time, I think, to establish a reputation. And because of that, Zimmer Biomet got me involved. And this is the Identity Humerus and the Alliance Glenoid that we're now involved with. But it gave me this opportunity to work with this international group of shoulder surgeons. And Bob was talking about before about how great it is to be able to work with people that you really admire and respect and can really bounce ideas off of and create something that hopefully is going to help us take better care of patients. And then finally, I mentioned this a lot as a department chair. I can't tell you how many young faculty say, "Dr. Levine, can I have $30,000 for marketing of my practice? Can I have $15,000? And all I say to them is, we can talk about that, but have you thought about using your own research as a marketing tool? So I wrote this paper back in 2008 on winged scapula, Jerry. And do you know how many patients from around the world continue to call me because it's a niche problem? I don't know if you want that niche problem to be calling you, but they do. So don't forget that research can be a very cost-effective way to market yourself in I think a very appropriate way to talk about research that you've done, and it does get to patients. So finally, why do research? I think you can help yourself, you help your patients, your career trajectory, and finally to help establish your reputation. Thanks very much for asking me to participate tonight, Bob and Peter.
Thank you. Thanks, Bill. That was great. I think, a lot of take-home points there. One of the things that you said is, being a closer. And I think that with advice, or how do you utilize research, or how do you become engaged in research so that you can then use it to become an expert? I think one of the things is that uh, is taking on projects and bringing them to completion. And I think that that not only shows your engagement, but also um, it's usually the pathway to more. And I think that a lot of times, everyone gets busy, and especially with residency and when you're in your fellowship or whatnot, or even in the early start stages of your career. So being able to create space to be able to do this type of work, you have to purposely do it. How were you able to kind of um, I guess make that space in your life, maybe not necessarily in fellowship or residency, but more in terms of your practice, to be able to say, okay, I know this is important. Um, what was your strategy to be able to do that?
Well, I think you have to remember that it's important to, when you first start your practice, there's nothing better than establishing routines of how to get research done, because most of us, no matter how dreamy your practice is, you have time when you first get going, which you don't have time 3, 5, 7 years down the road. So I think establishing protocols and establishing policies, establishing research opportunities, setting aside time for doing research. I mean, obviously, for me, that meant going to research meetings every week with Van Mao when I first got to Columbia. And that guy was, a slave driver. So that was pretty tough. But it taught me the kind of the rigor of what needed to be done to actually do basic science research. There's not enough time to go over. Obviously, there's lots of different pathways and you have to follow your heart. But I think it's really just starting early, Bob, and getting involved and making it part of your routine. Because if you try to add it on later, when you're already a huge, busy clinical, shoulder and elbow surgeon, it's really tough. And so I just carved that out early on in my practice and said, this is important and I want to, pursue this.
Yeah. Yeah, routines are definitely important. And I think, one of the other things that I'll get asked a lot is, and I think it's true, is that the other value of research, for me at least, is in doing the research, you have to know what everyone else's research is. And so, like, you can't write a paper without necessarily knowing what has already also been written. And the mere fact of the process of going through that makes you become an expert at some level, because you have to read and reread and reread all the same papers over and over again, because you're writing about them in the paper that you're going to write. And so I think that that is a value of research in and of itself, is learning that. But it would be good to hear, and even to get Jim and Jerry's feelings of, there's so much published information that's out there right now, just a massive amount of published information. As an expert, it's our, I guess, somewhat responsibility to be able to talk thoughtfully with regards to the information that's out there, and then put that in context of the experiences that you've had personally, to be able to then make some type of um, recommendation to other people. How have you been able to, now with this information overload, be able to manage that, to be able to get a hold of what is published? What do you think is important? How do you even create space in your life to be able to actually do that? And so it would be good to hear from each of you of what's your routine with that part of the world that we live in.
Well, I've always maintained that you have to, I try to look at it, there are people in the world that I really respect, and like Jerry Williams, Jim Kelly, there are two of them. And the reason is because when they're at the podium and they're talking, they don't sound like they are salesmen of an implant that they've happened to design. They don't sound like they're trying to push something. They're very thoughtful in trying to present a balanced approach. And I think that's the biggest challenge for all of us. And whether you're a designer or not, when you're giving a talk on a certain topic, you can spin that topic the way you want and support it with research by ignoring the other research that's out there and counters that hypothesis. So I always try to present both sides of the coin if I'm asked to give a talk, and try to make sure that I try to present a balanced approach. If there's only one way to do it or one thing, then that's different. But you and I think we all understand, the more we know, the less we know. And if you're super dogmatic about something, I think you have to be careful about that, because there's probably another way to do something or approach it that might be equal or better than what you're talking about.
Right. Jim, any thoughts with, like right now there's so much information. How do you kind of get your head around all this to be able to even teach your fellows? Do you know what I mean? To be able to talk in a relatively, educated manner that is in a way that's, I guess, reflective of you, of your experience as a surgeon, so that you can at least say, hey, this is not just what I've done over the past 20 something years, and this is the reason why I do it. It's because it's in the context of what everyone else has done. And I think people struggle with that, is how do you actually maintain a knowledge base when it's such a kind of overwhelming amount of information?
Yeah, that's a great question, Bob. And if you looked at my inbox with all the journals sitting there, you'd probably think that I don't do a really good job at it. But I mean, yeah, it's interesting you say that, because back, I think when we all started, there wasn't nearly as much information. I remember looking up tendon transfers to try and understand them better when I was younger. And there was a paper by Bob Navaiser and a paper by Christian Gerber, and then not much other than that. And now look at what we have. So for me, I must admit the JSES is a cornerstone of what I look at and read when I have time. Grab the few that I have not read on a plane when I'm going somewhere. I try to get to the JBJS, and I try to get to some of the other affiliated JSES journals, but they come too often for me. I think if you incorporate that and going to the meetings and being involved with guys like Bill and Jerry and yourself and Peter, interact, exchange ideas, I think that's what keeps me current, and having been around for a while and seeing that things, they change, but they don't, you see a lot of changes, but not all the changes work out that well. So having a little bit of history and being around a little while does help, coupled with what I said.
Okay. Jerry, any thoughts kind of how you've been doing this a long time and you've seen like the evolution?
To be honest with you, it's evolved. I've been doing this 32 years, and it's probably not the same now as it was when I first started. But what I try to do, and I think probably this has been the last 10 years or so, I really try to keep my thinking principle focused.
Okay.
There are certain principles that we all feel pretty strongly about. There may be some data that supports them. There may be some data that doesn't. And for example, let's take subacromial impingement syndrome as a perfect example. Okay, when I was growing up in the world, subacromial impingement syndrome was what Dr. Neer built most of his career on, or at least a lot of it. And we thought that 90% of all rotator cuff tears were caused by subacromial impingement. Then we came to the point where people think subacromial decompression is completely not required, to the point where insurance companies don't even pay for them. So the bottom line is, you can't convince me that a guy as smart and experienced as Charles Neer studied something for his entire career that was completely bullshit. So, when I see a paper that says there's no such thing as impingement, I read the paper and then I file it, because I know that principle in my mind is a real principle. I don't care what anybody says.
Yep.
That's just one example. There are lots of them. So I'm a 30,000-foot view. I don't know you, Jim, that well, but Bob and Bill know me pretty well. I'm a high height kind of guy. I don't get down on the grass too much. And principles are things that I try to live my life by. And if I get an article that seems to be really well done and really takes a shot at one of my principles, I'll think about it.
Yep.
But if I see just sort of a ho-hum sort of article that says you don't need to do acromioplasties anymore, I'm not going to spend a whole lot of time reading it. I think principles are important.
Yeah, I think that's honestly, it's a great way to frame things. And I will tell the residents and fellows, it's it's kind of very similar. So I tell them like areas of kind of things that we think about, disease processes, et cetera. It's like a Christmas tree, and that you at some level you need a strong structure of that tree of knowledge. And then it's really then easy to put on ornaments onto the sides of that tree, which happen to be other publications that come out that then can kind of dovetail into the things that have already kind of been established with regards to what is central to that principle, or what you might say is a central principle like impingement. And then it's really easy to remember or think about a paper because you're putting it in context of this other more primary structure, and a way to be able to then go back to something and say, oh yeah, this paper was published 10 years ago or 12 years ago. It talked about this. And the only reason that you remember this is because of how it's linked to that central principle. And so I try to follow that myself and teach the residents, but I like the way that you've actually described that. And I think it's useful for the people that are on to be able to.
Yeah, and every now and then something comes along that challenges a principle, and it sort of doesn't get your attention at first. And then as you keep seeing the information, it becomes more and more logical. And I think the perfect example of that is reverse shoulder replacement.
Sure.
I mean, when reverse shoulder replacement first came out in the 1950s, I think Dr. Neer had one of the first ones. It was heresy. And when people started coming out with reverse shoulder replacements, Grammont came out in the mid to late 80s with his, and then Mark Frankel came behind his with even more heresy with lateralization of the center of rotation. You know, for the first 10 years, everybody in the world thought they were crazy.
Yeah.
And now everybody in the world's got a reverse shoulder replacement, and most of them have an option for lateralization. So every now and then there's a principle that gets challenged, and it gets challenged well enough and long enough for you to say, you know what, I think I might have been wrong on that. And it happens.
Yep, that's great. Okay, that's perfect. And with that, Jerry, actually, why don't we segue into your talk? That'll be great.
This is going to be challenging. Everybody knows that I can't do technology worth of crap, but I'll give it my shot.
So far, so good. So far, so good.
Good, hallelujah. So, you know, it's interesting. You'd have thought that Bill and I talked to each other about what to talk about, because our talks don't overlap at all, hardly. I have a totally different kind of approach to this. And when you see what it is, it won't surprise you. I'm the dumb guy in the room. But so my disclosures are really that I designed a lot of the implants for DJO and DePuy. And I still consult with DJO, so I do have some conflicts of interest. So the first thing that I'll tell you, whoever's out there, you know, when I started in San Antonio, I came from an orthopedic place during medical school at Temple. It was run by John Lockman, and it was a really great clinical place, but didn't do a lot of research. I then went to join Dr. Rockwood in San Antonio, and to say that we didn't do a lot of research is an understatement. So I just knew early in my career that I wanted to be an academic shoulder and elbow surgeon, or at the time there was no such thing as an elbow surgeon. It was just shoulder surgeon. I didn't know how to do it, but I knew that that's what I wanted to do. So I would say the first thing that you really have to do is to identify that you really want to be an expert in something and commit yourself to it, because it's not easy. You know, you just have to have a lot of luck. You got to have a lot of hard work. You got to try to be your best every day. To this day, I go over the x-rays of our total shoulder replacements for our fellows after we do them and say what we did right, what we did wrong, what we could have done better the next time. And as I said, I've been doing this 32 years. If you want to get busy, say yes a lot. The problem with that is you got to figure out how to get a work-life balance. And I'm not going to say that I was good at that when I was younger. I actually got better at it later in my life. You know, the first half of my life, I went 1,000 miles an hour with my hair on fire for as long as I could. I went to sleep and got up and did it all over again. I really didn't have any plan that was more complicated than that. Somehow it worked out. But saying yes a lot does help. And you got to work at your craft. You have to learn from your successes and failures. You got to try to expand your skill set, do something that you haven't done, learn how to do it and do it well. If you're going to be an expert, you really do have to be an expert. Okay, now what? There we go. So the other thing I'll tell you is you can't do it alone. You can't become an expert in anything in orthopedics, just, you know, hanging a shingle out and deciding you're gonna be the expert. You got to have help. And we all have help along the way. And if I had to put a presentation of all the people who helped me along the way, we'd be talking for 10 hours. So I picked some of the important ones. So Dr. Rockwood believe it or not, was the one that talked me into shoulder surgery. I went to San Antonio wanting to be a knee surgeon. He's the one that talked me into being a shoulder surgeon. And when I left San Antonio, I had no idea how to do research. I had a few papers, but they were nothing special. I then came to Philadelphia and at some point joined Joe Ionati. And Joe, for those of you who know him, is an unbelievably skilled researcher. He's a great surgeon, tremendous administrator, good leader. And I wound up working with him. I went to private practice all by myself for the first year and joined Joe at Penn the year after that. And after we'd been there together for about 5 years, we brought Lou Soslowski to Penn. And when I first got there, Joe said to me, Jerry, you don't know a doggone thing about how to do research. You don't know anything about basic science research. You need to go to the lab. So I did. I went to the lab 2 days a week for like 5 years, did all kinds of biomechanical research because it's about all I knew what to do. And it did make me a better surgeon. It made me more of an expert. And so the point I'm trying to make is you run into people throughout your life and your training, even when you're just practicing with people that may work with you, they may not. You can learn a lot from them, and you've developed relationships with them. They will help bring you along to become the expert that you would like to become. So I think there's a lot of luck in it. Anybody, I don't know if I can't ask anybody because they can't respond, but this is a book called Good to Great. Bill's heard this lecture. You know, we all know people who get lucky all the time. They seem to be the same people. You know, everything just works out for them. It's hard to figure out why. So this guy, Jim Collins, who's an economist at Harvard, studied the Fortune 500 companies and broke them into a bunch of industries. And he tried to pick the winners and losers based upon certain criteria. And he had a few hypotheses in the beginning. One of them was that the great companies would get unlucky less often and lucky more often than the ones that were losers. And what he basically found was that wasn't true at all. The number of unexpected chance events was the same in both. The difference is what they did about it. And he called that return on luck. So the winners would get into a good luck situation, realize that it was a good luck situation, change what they were doing in a significant way and take advantage of that. And the opposite for bad luck. And everybody on this slide is an example of me in my life where I just got lucky over a certain period of time, and I was lucky enough to recognize it. The three on top were people that came into my life at a time where we needed another person to work, and I wasn't really looking, but they landed in my lap, and we wound up hiring them, and it makes us all better. The three on the bottom, obviously, I was lucky just to meet Joe Ionati. I moved back to Philadelphia. You know, I was in private practice for a year. I borrowed $140,000 in 1990 from a local hospital that was a teaching affiliate of Penn's. And I just hung a shingle out, solo private practice. And I went to the Penn conferences on shoulder and elbow every single time they had one. Joe recognized me, asked me to come join him in 6 months. And the guy in the middle is a guy named Andy Carduna, who was the guy who was at Lou's lab before Lou got there. And, you know, we had this hand-built wooden thing with pulleys and crap, wanted to do biomechanics of the shoulder. And that's where I spent my time. And I had no idea what I was doing. But I was lucky enough to realize it. I was lucky enough to land in the lab of the guy who's one of the best researchers in the world in a great university with an opportunity to do basic science research. And I just did it. And it was an example of a chance event that happened that I took advantage of. And all of you will find the same thing happen multiple times in your life. You just have to recognize them and go for the gusto. And you also have to remember that everything you do every day, it makes a brand for you. It doesn't matter where you're working. You could be working at Columbia, you could be working at Rothman, you could be working anywhere. When you walk into the hospital or to the office, everybody that you meet is looking to see what you're about. They want to know whether you're on time, whether you're trustworthy, whether you're honest. And they're taking note every single time they see you. So you have to realize if you want to be an expert in something, you got to start acting like an expert from day one, and you got to start making the right decisions. The other thing is this is sort of my plea to not do what I did. Okay, so by the time I was probably 50, I figured out that the 1,000 miles an hour where your hair on fire probably wasn't sustainable. So I began thinking about how I would go about the rest of my career in a way that might be productive. And the reason I'm putting this slide up for you guys is because you need to do it as soon as you can. It's a process that's very helpful, thinking about where you are, where you want to be, how you're going to get there, do some things for a while, reassess the situation. It's just a really good process. And if I had gotten involved with this process earlier, I'd probably be a little less crazy than I am. And so, the final thing I would tell you is there's basically 4 choices in terms of ways to become expert in anything, but we're talking about shoulder and elbow surgery. You have your clinical prowess, you have your ability to do research, you have your ability to teach, and your ability to do administrative things, which I look at as a form of leadership. You can't do them all. Well, Bill Levine can, but most of us can't do it all, okay? And so what you have to figure out is which of these 2 or 3 things you do the best, number one, and number 2, make you the happiest. And focus your time on those things and maybe not so much of your time on other things. For example, in my particular world, I tried to do them all. I thought clinically I was pretty good. I loved to teach. Didn't have a lot of leadership positions in the beginning, but some. And I really tried hard to become the best basic science researcher I could, but I'll be honest with you, it's not in my DNA. So as I became older, I decided I was going to spend more of my time doing clinical research, picking out a part of my clinical practice, i.e. arthroplasty, that I really liked the most and focusing on it, and then spend a lot of time doing leadership things and teaching. And I guess what I'm saying is it took me till about age 55 or 60 to figure that out. You guys should try to figure that in your first decade of your practice. It'll be a lot healthier for you. And I think that's all I got. Thank you.
Oh, that's great. Really amazing, Jerry. Awesome. Lots to think about. I think that, I think you make some really important points. Having mentors, creating a plan, making sure that you're thoughtful with regards to kind of your approach of what you're doing every day in clinic, and you're thoughtful with your approach to what you're doing for your career. And I think, honestly, a lot of the, you say those things and you're like, oh, well, that's makes sense. That's easy. Shouldn't we all be doing that? But that takes time and energy and effort to be able to actually do that. And I think everyone gets kind of wrapped up in what they're doing. And because of that, you become less purposeful with regards to this. And again, it's where the discussion tonight is, how to become an expert. And you raised the point at the beginning of the first slide is, do you really want to become an expert? Do you know what I mean? Is that part of what you want out of your career? You don't have to be. But if that is the pathway with regards to what you would like to follow, then you would at least need some type of, some guidance or some ideas with regards to how you get there. What do you, I think the points that you make about mentors, the one thing that I've noticed is that younger surgeons can help you as much as older surgeons. So mentor does not necessarily have to be someone that is older than you. And I've been lucky with this, and it would be nice to hear. I mean, clearly you had 3 people that was on that slide that are junior to you in terms of, from a practice standpoint. Bill, have you had that experience yourself, kind of from that you've actually found a mentor, even, I guess, or maybe not a mentor, but a colleague that has made you better, that is, you could say that might be a mentor you're taking things from, that is actually, that has, I guess, less years and experience than you?
Yeah, well, Chris Ahmad and I talk about this all the time. If you're not bringing in people around you who are better than you, then you're not doing a good job of recruiting. And so I 100% agree with that. And none of us would be where we are without mentors. And so it's, incredible. And the other thing I'll say about mentorship, which is important for the folks on the webinar tonight, guys, is that your mentors don't have to be people who actually trained you. Like, I consider Jerry Williams one of my mentors because he just took an interest in my career and has always been an incredible sounding board and incredible support. And he had no reason to have to do that. Like, there is zero reason, but it established a mentor-mentee relationship and early on when I was younger and had brown hair. And then it evolves and more hair. And it evolves, those relationships that are most special in life then evolve to friends. And that's kind of the beauty of research and the beauty of this academic world in which we live, which people don't, I think, talk about nearly enough. So if I count the number of mentors I have, it is longer. As Jerry said, it's like 5 pages long, but many of them I didn't train with. I had no real connection with, yet I reached out to them and they took an interest in, and I think that's a really powerful part of what we do.
Well, Bill, I'd like to take off on that a little bit. So part of it has to do with wanting somebody that you really like to do well. But I think part of it looks at a younger person that does things really well and saying to yourself, maybe I could help him, but I think if I hang around him and try to learn what he does, does how he does what he does, it'll make me better. So I think it sort of goes both ways. And the one thing I forgot to say, Bob, and I shouldn't have forgotten, the other thing that you need to have if you're going to go down this pathway, you need to have somebody to share it with. And it doesn't matter who it is, but you need to have somebody that's close to you in your life that sort of understands how crazy you are about this crap and will let you do it without completely persecuting you until you get to a line. We all have the lines. When you get to that line, you get smacked with a baseball bat. You understand that you went a little bit too far and you come back. You got to have somebody like that in your life that can sort of keep you honest.
I would agree.
Sure.
I can't agree with you more. And that you're right. That can be anyone. That could be your spouse. It could be, honestly, it could be one of your brother, your sister, your parent. It could be one of your children. Do you know what I mean? And I think that we all have different relationships with other people. It could be one of your best friends that actually is able to speak honestly with you, that then would be able to kind of let you know when things have gone a little bit too much or too far, and that you need to kind of corral it back in. And I'm sure that everyone has been there. I know I have been there personally, that where you're kind of running on red. Do you know what I mean? The engine is going and you're not sure if there's anything that's holding the engine together. And that those are the people that are in your lives that are able to kind of bring you back around and kind of ground you to the point to saying, okay, you need to start thinking and taking care of yourself. And I think that that is a risk, and it's a good topic to be able to discuss a little bit of, you know, everyone is that wants to kind of do this. It's very rare that you can kind of do this without sacrifice, and I think that that is really a key. Is that some of the things that we're doing, that there's you're missing out on other things because you're doing this at the level that you are. And
The hard part for us is actually realizing that we are sacrificing.
you're right.
The people who are around us that we're trying to spend our lives with, they know very well we're sacrificing because they're what we're sacrificing. But we get so wrapped up in what we're doing. I always used to tell people, you almost forget to go home. You're having so much fun at work. You're looking for a bed where you can sleep in your office so you can get up the following morning and get started more earlier.
Yeah.
I mean, you got to have somebody in your life that takes those thoughts out of your head and brings you back down to earth.
Right. I'm with you. And I think that sometimes life does it to yourself, meaning that you've seen it in friends that they get sick, they get hurt, because they're working too hard. Do you know what I mean? And I think that it's a balance that everyone needs to actually understand. And that I think it's great that you bring it up, because there's a cost to doing everything that we do. And I think if you have someone in your life or multiple people that can help kind of put some boundaries to that, then it'll make your ability to be able to become an expert or to become really proficient in a field much easier. So I can't agree with you more. The other part that I thought was really interesting, which I totally agree with, which I want to bring up, is your last slide, which had the 4 different areas of what you can become expert in. And I think you're dead on, and you made the point, which I think is important, is you should do what makes you happy. And because like doing something just for the sake of doing it, it never works out. Do you know what I mean? Like if you say, okay, I'm going to do research, like you said, because someone told me to do research. Well, if you're not really in love with research, then the reality is that you can do it at some level, but you're not going to become an expert in that. And same thing with leadership, or same thing, don't just sign up for a position in the ASES just because you want to click a box because you think that's the way of your trajectory to be able to become an expert in the field. You should sign up or want to do something because you're engaged in the process to the point where you find it important. And I think that that also is not necessarily spoken enough. And I think you made the point with that we should be doing things that we love and want to spend time doing, and not necessarily just doing things for the sake of doing them. It's great. Thank you, Jerry. Appreciate it. Jim, why don't you pull up your slides and let's.
Okay, and Bob, thanks a lot for having me. I really feel honored to be on a panel with Bill and Jerry. Let me get this slideshow going here. View slideshow. So I'm sure there are some people on the webinar don't know me. So just by way of introduction, I know Bob did that already, but I'm out here in San Francisco, and I've been involved in the fellowship out here for about 23 years. I'm also the chair of orthopedic surgery out here, and we formed an orthopedic research and education foundation a couple of years ago, which is something we just started, but I'm hopeful to leave that for my partner, Mark Schrumpf, to carry on in the future. I'm in a private practice group of 14 surgeons. So I think most of what I'm going to say today or tonight has been said already, but I want to emphasize that I took a bit of a different pathway than the others that are here. My disclosures are I'm a designer and receive royalties from both Smith & Nephew and Stryker. So I studied chemical engineering in University of Rochester. I went to Vanderbilt for School of Medicine. I took a divergent path and went into the Navy and spent about 6 years in the Navy as a flight surgeon. And as I look back, when I finished that and had to go back to residency, I really felt like, why didn't I get my residency done earlier when I was younger? But now that I'm older, look back at that experience, I'm really glad that I took the time out to do that because it was very meaningful to me, and flying is something I always wanted to do. So subsequent to that, I was at orthopedic surgery residency, and then I did my fellowship out here with Tom Norris. And then I went into 5 years with shoulder, tried to focus in shoulder, but was really in general orthopedics. And I'm sure this will resonate with a lot of folks that get out into a job that, it's an orthopedic surgeon, but maybe it's just not fulfilling your goals. And I was fortunate enough to be asked to come back with Tom Norris and Relton McCarroll, who I did my fellowship with. And I just want to say, and I think it's been emphasized earlier, that these associations you have, they're absolutely transformative. And when I came back with Tom and started seeing shoulder patients, it's amazing the instant credibility you get with just being associated with someone like that. And the partners of Bill and Jerry, Bob, I'm sure they all experienced this same sort of thing. And that really started my trajectory to become a shoulder and elbow surgeon. So I'm just going to briefly, because I know we don't have a lot of time, go through some of my tips to those folks who are out there who have heard all this great commentary from Bill and Jerry ahead of me. But here are a few of my tips and things that I think will really help you move forward. First of all, if you can position yourself in a practice which has a high potential for high volume cases, I think that, especially early on in your career, that really helps you become skilled and learn what to do. But you have to be careful. And I felt when I first started, I really felt that I needed to be taking on the biggest and most complex cases to get credibility. And I'd be very careful about that. I would make sure that you're staying in the middle of the road and just doing a really good job in every single patient that you take care of. That's a mark of a professional, and that's what people will look up to you for. You do not have to step out and start doing the most elaborate operations right from the get-go. Relationships have been spoken about extensively already, and I'll tell you that, it's a lot of work what we do, and it's the relationships that make this enjoyable and make us passionate. And so you can identify people you really want to work with, and from there you can take it into research and whatever activities you want to do. But I really think, as Bill and Jerry have mentioned, that's a really cornerstone for my success, is to establish these relationships and grow them. And they can be with orthopedic shoulder and elbow surgeons. I have a group of 5 surgeons I've known for years, for 25 years. We've always kept together. We've done projects together, and they're some of my closest friends. And in fact, after the academy this year, we all went up to Sonoma and spent the weekend together. I think it's important as a young orthopedic surgeon to get to know the local and regional orthopedic surgeons and go out there and show your face, get involved in conferences. I chaired a bunch of different conferences when I was younger and got to know all the general orthopedic surgeons, and that formed a web and a network of referrals for me that's been going on for 25 years. Industry has been mentioned. As far as industry goes, I know Bill said he started kind of late on that. I'll admit I was involved with Tornier back in the day. Tom Norris was involved with Tornier, and the ability to get to know and work with Pascal and Gilles early on was also very helpful to me, and really I think with it helped me become who I am today, and those guys are just fantastic. There was Jerry mentioned commitment to shoulder and elbow as your practice, or commitment to shoulder and elbow surgery. At some point, especially if you're not in an academic setting where you're just the shoulder and elbow section, you're going to probably be doing hip fractures, maybe ankle fractures and knee fractures, and at some point you just have to push that aside and commit to shoulder and elbow surgery. And it is hard in private practice, but when you do that, you'll find that the shoulder and elbow will sort of fill that space. And when you can go and move forward at that depends to some degree on your practice, your finances, and your family and your time. But that is something important, and probably should happen as soon as you can make it happen. You should define your goals and think big. My main goal for my career was just to get into ASCS, to believe it or not. And the first time around, I didn't get in. And now, turn around 15, 20 years, and now I'm the co-chair of the membership committee. So go figure. You can certainly exceed your goals, but define them early and think big. As far as research goes, a lot has been said. I think that this is, and I think Bill really hit it on the head. It's such an important facet of becoming an expert. And to me, the start of it, in shoulder and elbow at least, it was just defining a question. It can be really simple, and figuring out how to answer it. And back in the day, when we first started doing reverse shoulder replacements, there was one base plate. It was 29 millimeters in diameter. And we kind of didn't know exactly where to put it on the glenoid. Low was what you were told, but what exactly is low? And so I grabbed the fellow, and we bought a dozen scapula and got the CT scanner at the hospital to help us run in there and do some scans. And we just tried to figure out a rule of thumb for where to put the base plate. And we ended up publishing 2 papers out of it. It was a lot of fun. It's interesting. It seems so simple, but it's a little more complex once you start looking at it. And that was really remarkably satisfying to go through that process and learn how that works. And we basically did it on our own. So that was a lot of fun. Other things you can do: track your cases and your outcomes, because you never know, you're going to be asked to do a talk. You have this data, you can show your own data. And it's really important, as Bill said, to be able to show what you do in these talks. Take pictures and video, because when you're asked to do talks, it's a lot better to show what you do and demonstrate what you like to do, because that's what people are looking for. Everybody has access in their communities to resident and fellow education. And as I think it was Jerry said, he just started to go to the Penn shoulder meetings, and that's exactly what I did, go into UCSF, and lo and behold, you eventually get asked to come back and do grand rounds. And that also just moves your career forward. Again, it's already been said, but say yes, but really only if you mean it. So there's a lot, ASCS has grown so much, and there's so many things to do. And you'll get a lot of offers to do a lot of things. When you say yes, you want to be somebody that people recognize for the work that you put into that committee. So make sure you mean it. There's a few people that I know that have been fortunate enough, even in private practice, to get their own research assistants. And I have not done this. Armand Hatzidakis is great at this, but at some point, if we're moving towards that in our institution, in our practice. And it's something you can do, and I think it's important if you really want to move the ball forward. I'm a little late in my career to really make this happen, to make it meaningful, but I think it's going to be helpful for my partner. It can be done. Funding is an issue. Sometimes with industry, you can work with them on a variety of formats, and that can help that out. Lastly, I showed these slides to my fellow and said, you know, have I said anything meaningful? What do you think? And she said, yeah, I really like what you said, but what I want to know is, how do you manage your work-life balance? And I think it's already been mentioned, but I think you really have to do and be engaged in activities which make sense according to your values, your skills, your interests, and your time availability. You've got some remarkable other folks on this call tonight. You know, American ASES presidents. I will not be that, but I've defined what an expert means to me, and I'm super happy about it. And you have to define what kind of expert you want to be, and there's going to be a time commitment, and there's going to be certain sacrifice that's going to get made for what you decide to do. As far as, you know, work life, you know, I have two boys, they're 18 and 21. My wife is a retired neoplastic surgeon. So it's quite a bit of a balance. And I really like skiing and biking and golfing. And you know, if on the weekend I can get my wife and two kids and go skiing on the weekend, that puts everybody together and we all do something we like. And that was a formula for success for me rolling through taking care of and raising my boys. As far as research and consulting and speaking, I think you got to be involved. I already spoke about relationships, set parameters, make sure that you fulfill all of your goals, as Jerry mentioned in that sort of circle diagram, so you have a successful work-life balance. Thanks again for inviting me to talk.
Thanks, Jim. That was great. Honestly, it's great because it's another, you know, it is another perspective. And so at some level, you know, where you are an expert, it's just like how you said, it's how you define it. You know what I mean? And I think that it can be, you know, shoulder and elbow in your community, in your hospital. It can be within the country. It can be internationally. And where you set that for you personally to make you happy probably defines the pathway with regards to how to best actually get there. So I completely agree. I think you're right. And it doesn't necessarily mean that everyone has to become an president of the ASES to feel that they have been successful as becoming an expert in the field. And I'm sure that Jerry and Bill, as past presidents, would probably also agree with that statement. The other thing that I noticed that was interesting, which I didn't get mentioned, is, and I think it's really important, is travel. And that's not really discussed a lot, but when people get wrapped into, you know, starting their practice and building their practice and et cetera, the last thing that they want to do is take time away from their practice to be able to go visit another surgeon or go travel internationally, to go to a meeting and present your data internationally, et cetera. But I'll be honest that for me, every single time that I've done that, I have been the payoff for me, whether it's from what we do in shoulder and elbow standpoint, or more just personally, the payoff of what I've gotten out of that experience has always been so much more than whatever time I could have potentially spent doing another case or seeing another patient, et cetera. And so you kind of started to discuss a little bit about that, or kind of bleeded into that, but I kind of I peeled off on that idea myself, and it would be good to know, I guess, from as we're kind of closing the last couple minutes, of each of you, Bill, Jerry, and Jim, have you been able to take opportunities to be able to, you know, take away from your practice, to spend time to be able to actually educate yourself, and then through that feel like that has been a way to further your ability to become an expert in our field? And it can be in research, spending time doing research elsewhere, or even or traveling to see other surgeons or speaking or whatnot. Jim,
Well, I'll say that in 2003, I had the honor of representing the ASES as one of the two traveling fellows with Pat St. Pierre. And, you know, that was one of the most transformational and impactful experiences of my life. 8 cities, 7 countries, 33 days. and meeting the people that were the legends in the shoulder and elbow world internationally was just, beyond belief. And then that carries on now, because now I have Gilles come back and serve as a guest lecturer, or Christian, or Philippe Collin, or all of these, Philippe Valenti, all of these friends that we develop internationally are now, we're one big shoulder and elbow family. And that's both personally and professionally is, again, kind of what we're talking about with mentorship, Bob. It's one of the beauties of what we do. And whether you're a private practice at CPMC like Jim, or at an academic or private academic, or Kaiser like Ron Navarro, you can, in any of those 4 platforms, you can have the exact same experiences, which I think is really important for people to hear. It has nothing to do with being at Penn or Columbia or Rothman or any of that. It has to do with Jim getting involved early on and meeting Pascal and Gilles, and then becoming a local expert, a regional expert, and an international expert. It's really pretty cool that the pathway is not set in some kind of stone.
Yep, I would agree. I mean, I was lucky enough to do the fellowship, not, back in 10 years after Bill did the fellowship. And so you can go through those pathways, and people might say, oh, well, if I don't get selected, does that mean that I can't do this? And I'll be honest, you don't. So in 2009, I was 3 years into practice, and I said, I didn't learn how to do Latarjets because Ken was doing like iliac crest at that point. I was like, okay, well, if I'm going to do this, I want to learn how to do this. So I asked Ken, I was like, hey, can you set me to go over to France and, hang out with Gilles? So I took off my practice in the 3rd year of my practice, 4 weeks, a month. I just stopped, and I'm like, here we get paid by how much we do. And I just went there to be able to learn how to do a Latarjet from Gilles. And that honestly has evolved to the point where a lot of the things that I've done in surgery or shoulder and elbow surgery partly has stemmed from some of those experiences of learning and being able to meet other people, to the point where Sunday morning I was on a Zoom call with me and Gilles going over CT scans, when, even though he's technically retired, he wanted to do a research project. And so it's 8 a.m. and I'm spending 2 hours on the computer with him looking at CT scans when he's retired, and we're going to do actually a publication together on these CT scans. So, at some level, 15 years later, he's still, part of what I'm doing, even up until yesterday. So I think, Bill, you hit the nail on the head that, get out there, do things, become involved, go find other surgeons. It doesn't have to be international. It can be, you go visit Bill Levine and Jerry Williams and Jim Kelly. And that in and of itself is going to create value for you personally to be able to move along your own personal pathway. So any closing thoughts, Jerry or Jim?
No, just thanks for the ASCS for putting it on, to Smith and Nephew for sponsoring it, and for Bob and Peter, you asking us to participate. It was fun.
Great.
No, thanks very much, Bob. I had the same experience with Gilles, visited him, and now I've had the opportunity last month to send my own fellow out to Gilles, Lionel, and Alex, and spend time out there. So yeah, I concur with your observations and recommendations.
It's great. Peter, any thoughts? Anything for the guys here?
No, I think most of it has been said. I really enjoy listening about your remarkable journey to become great experts. One thing maybe for the young fellows or residents who would like to follow your path, would you recommend them to seek the environment where they can pursue research, or try to create their own, maybe at a slower pace, but learn out of that experience to become greater researcher, administrator, teacher, and ultimately a surgeon?
It's a good question. Bill, do you want to take a shot at that?
Peter, I'm sorry, can you just repeat it again? I'm sorry.
So I for younger fellows and residents, the question is, if they choose to followed the journey similar to you, would you recommend them to look for a place which has an environment to pursue research, or to start their own, find it created from down up, and learn from that experience as well?
Well, it's, you know, this, like Jerry said, I mean, my coming to Columbia with Louis Biliani and Evan Flato, I'm nowhere without them. And so that is 1,000% why I chose that path. And could you do it starting on your own de novo? Yeah, but you know how much harder it is to do that. And so if you have an opportunity, you know, for me, I was choosing a place where I wasn't going to be the 10th guy on the team, and that was important, because I think there's a difference between that and being the third or the fourth person. But again, personal decisions. I think if the biggest thing, and I think I heard it from all of the speakers, you just have to be genuine. If this isn't coming from your heart, then don't do this, because it's way too hard a path for us to, you know, for you to go down that road. And if you're really genuine about it and you wanted to start on your own, Peter, God bless you. You know, reach out for some support and have people that can help guide you, but go for it.
It's hard though. I mean, if you want to think of recent good examples, Pat Denard is one. You know, it's hard to do. I mean, I started, as I said, by myself in solo private practice. If that's where I'd wound up, I wouldn't have done any research. Winding up at Penn with Joe Ionati and learning how to do research was very helpful. And then when I carried it over to Rothman, and then of course I hired the two right people, first Joe Abood and then Seren Namdari, that didn't hurt me any. So the bottom line is, I think you do better with a team.
Yeah, and I can say I'm kind of off and doing my own thing, and I'm not nearly as prolific as the others that are here, and it's just harder to do. But if you want to talk to people that have done it, yeah, Pat Denard, Armand Hatzidakis, you know, Mark Frankel started his own. Scott Humphrey has a smaller outfit, but it's hard, and you're better. I think you have more opportunity within a place where that's all set up already.
And I would say, even if you don't say that you don't want to join an established kind of say structure like Columbia Shoulder and Elbow, which has been around for a long period of time, having some resources around you at a university, as long as you actually understand the resources that are there, that can be the first step for you to be able to actually do the things that you need to do. So collaboration, identify what the resources that there are other experts around you that might not be in the field of shoulder and elbow surgery. They might not even be in the field of orthopedics. But if you can identify those people and then engage them, then it eases your pathway with regards to you becoming an expert because now you've got other people to collaborate with that are experts in their area or their field. And that will then create your own silo of what you're actually good at that maybe others throughout the United States or even the world don't necessarily have those resources. And that can then become your niche. And so I would agree, though, the things like, you know, Pat Denard or honestly, John Levy is a perfect example. Like what John has done is really
true.
It's kind of tremendous what he's done, because he has gone, you know, pure private practice, and just out of smarts and sheer will, you know, he's had great mentors, but from his environment, he really had to actually create an environment that would be able to lead to a
It's a
success.
great example.
Yeah, and so it's there, but I think it's a unique experience for that to work out. So, all right, guys, I think with that we'll end the webinar. Again, I want to really thank Bill, Jerry, and Jim for spending an hour with us talking about this great topic. I've learned a lot, and I hope that the other people online tonight have. This is going to be available also on replay through the ASCS, that you'll be able to actually access this, and other surgeons will be able to access this at a later time. And again, I want to thank Smith and Nephew for their participation in being able to sponsor this and other webinars that we have put on through the ASCS Research Committee. And with that, I will say good night to everyone.
Have a great night. See you.
Thanks, everybody.
Thank you.